Hello, everyone. A note about, I was going to talk about this before the presentation, but we're not allowed to have food in this room. We can have drinks if they have a lid. I just wanted everyone to know that before we get started, okay? I think we're going to get started if everyone's ready. There's only a few more people out at the table, it looks like, but they're going to trickle in. Welcome to the Human Trafficking Medical Symposium. I want to thank everyone for being here today. A lot of planning has gone into this over the past year, and we're really excited about the upcoming week. And a big thank you. We have some thank yous, some shout outs to do. We want to thank our sponsors. You can see on the back of the brochure all of our sponsors for this event. Thank you to them. Thank you to speakers who have traveled really far to be here with us this week. Todd, our technical support, for helping us put all this together, and the VCU School of Medicine for allowing us to use this space. We also have some housekeeping announcement, like I said, about eating food in this room. No food is allowed in this room, but you can have a drink if it's covered. Water bottle's fine. Coffee, if it has a lid on it, is fine. And then bathrooms are located out the door in that corner of the building, as well as a water fountain. And then I was supposed to tell you we're going to have lunch today from 12 to 2 in that lecture. We'll be having Toasties, if anyone knows what Toasties is. It's sandwiches. And then I'm also supposed to say we validate parking. So if you parked in a VCU visitor lot, we validate your parking. So let the people at the front know. Okay? And a note about how the symposium is organized. This presentation will be given at 9 a.m. every day. So if you're here today, welcome. And you're going to get to see this presentation today. And then you're supposed to kind of build a foundation here. And then as you go throughout the lectures throughout the week, kind of build upon that foundation. And we offer this lecture every day just in case people can't come every day of the symposium. So that lecture, you don't need to come every day if you don't want to, but you're welcome to if you want to. Any questions about all that I just said? No? Okay. Well, we'll get started.
Okay, so hi. Blip about the survey, just making sure everybody did the first part of the survey until you get to the page that stops here before we start anything. And at the last lecture you're going to attend, after you finish your last lecture, then you could do the second part of the survey and then hand it out to any one of us that you see out there collecting the surveys, okay? And I'm going to introduce Miss Caitlin Hauser. She is a fourth-year medical student here at the VCU School of Medicine who is going into OB-GYN residency. She grew up in a small town in North Carolina and attended a North Carolina State University where she majored in human biology. She is a co-founder of the Student Interest Group, which is what we all have buttons for, Fighting Human Trafficking, and serves as the marketing and advertising chair for the Human Trafficking Medical Symposium that we're doing this week. And she's going to talk to you guys about an introduction to human trafficking.
Thank you, Tawani. All right, so this presentation is really about, giving you a broad idea of what human trafficking is, what it is not, and let's see, sorry, my clicker's not working. Okay. Give you an idea of what human trafficking is, what it is not, who is at risk of being trafficked, and what our role as healthcare providers to help combat trafficking. Human trafficking has been getting a lot of press with the Me Too movement, the Jeffrey Epstein case, and ACOG, the American College of Obstetrics and Gynecology, released a committee opinion about human trafficking. So it is a hot topic and people are really talking about it. And I just thank you guys for being here to learn more about it and educating yourselves. So we'll start with the definition of human trafficking. Human trafficking is the illegal trade of human beings. Force, fraud, or coercion are used to compel another person to provide labor or commercial sex. It is the business of stealing a person's freedom for profit. When you buy and sell a person, they become commodities. They become property. And they can be sold on the same websites that you go to buy furniture or to sell a car. Humans generate a lot of money for traffickers because there's low startup funds. You don't have to buy guns or drugs to sell a human. You just have to control a human to be able to sell them. Trafficking people generate a lot of money. Traffickers lie, they assault, they threaten people to work in inhumane conditions. Traffickers trick, defraud, or physically force people into providing sex or labor. And it's important to note that human trafficking is not smuggling. Smuggling is a violation against international borders. Human trafficking is a violation against a person. A person does not have to cross state lines to be trafficked. You can even be trafficked without leaving your neighborhood. And so it doesn't have to be like people coming from another country being trafficked to America. Polaris is a wonderful organization. They aim to serve survivors of human trafficking through the 24/7 National Human Trafficking Hotline, and they coordinate referral partners nationwide. They collect data and statistics about human trafficking in the United States and try to capture the extent of the problem. Human trafficking is kind of this invisible crime, and it's very covert, and people are not likely to report it. So the statistics we have are really from this hotline, and so we don't really know the actual scale of the problem, but this gives us a good idea. So you can see in 2018, 29,000 phone calls were made to the hotline, 5,000 texts. There were also emails, and they had over 41,000 total contacts during that year. Survivors were identified, and there was actually a 25% jump in cases of human trafficking from 2017, so more people are reporting this crime. And you can see that there are locations across the United States. Law enforcement have found human trafficking in all 50 states. It's estimated to be a $150 billion industry a year. The crime is happening to US citizens, foreign nationals, men, women, children, trans, LGBTQ, predominantly affecting women and girls, but also affects men. More Polaris statistics. Like I said, there's no official estimate on the number of human trafficking cases in the US, but it's estimated to be in the hundreds of thousands. More than 49,000 total cases of human trafficking have been reported to the hotline so far, and the hotline receives an average of 150 calls a day. In 2016, to kind of give you a global scale of human trafficking, they estimated there are over 40 million people affected by trafficking globally. 81% of them are trapped in forced labor, 25% of them are children, and 75% of them are women and girls. So we're going to have a whole lecture on debunking the myths at 10 a.m., but I kind of just wanted to talk about this one in particular. In 2006, the US Department of State estimated about 15,000 foreign nationals were trafficked through the US per year. But then data from the 2008 to 2012 National Human Trafficking Resource Center revealed 41% of sex trafficking cases and 20% of labor trafficking cases are of US citizens being trafficked domestically. And in 2018, the top 3 countries of origin of federally identified trafficked individuals were the United States, Mexico, and the Philippines. So this is a crime that is being committed to our own people, not just foreign nationals. And it's important to note the countries. The U.S. State Department listed the U.S. as the #1 country of origin of federally identified trafficked individuals in the United States. So I was reading the 2018 Federal Human Trafficking Report, and I found these figures very alarming. You can see this is the business models in 2018 criminal sex trafficking cases, and 88% of them use the internet to sell humans. You can see there's street, massage parlor, bars or clubs, but mainly internet was the #1 way people were sold. And this is really alarming. I mean, this is how people buy cars, how people buy clothes. I mean, it's the same kind of business model. And then you can see on the right online platforms and internet-based commercial sex cases. And you can see Craigslist, Facebook, and Backpage listed. Backpage is actually a classified advertising website that had become the largest marketplace for buying and selling sex by the time the federal law enforcement agencies seized it in April 2018. So thankfully, that website has been taken down, but other websites are emerging. So this is on the internet we use every day. So now we understand what human trafficking is, the scope of the problem as best we know it. And I'd like to move on to a survivor's quote. Survivors have shared their stories, and they're the best information we have about what it is like to be trafficked and how we can help them and intervene as healthcare providers. This is part of the quote, but I'd like to read the entire quote. I was groomed very well at the beginning, and then my abuser switched on me in a very mean way. And at that time, I thought that I loved him, and then it came to the point where I was deathly afraid of him. I felt like a slave for working for someone, getting beat and not getting paid, not having control over my life. For a long time, I did not realize that I was trafficked. I thought that because he gave me a choice to stay or go, and I chose to stay, that it made it my fault and my responsibility. So I think that touches on a lot of things that we're going to talk about in the upcoming slides. Just as the quote I read mentions, the grooming phase is the beginning. Traffickers are masters of selling dreams. They lure people by selling dreams that people crave, like fame, wealth, popularity, stability, security, happiness, sense of belonging, and a sense of being valued. This is just a list of some common promises traffickers use to trap people. Once trust is gained, that switch is flipped. And then, like she mentioned in the quote, that she used to trust, and then all of a sudden he turned on her in a mean way. So everyone could potentially be trafficked, but there have been risk factors that have been identified, and those with the greatest risk is anyone with a vulnerability. Vulnerabilities include age. The younger a person is, the less likely they're aware of the situation, the easier it is for the trafficker to manipulate and control them. Low self-esteem, needing searching for acceptance or a sense of belonging. History of being abused is a risk factor. Poverty, homelessness, history of CPS involvement, being in foster care, or identifying as LGBTQ trans, just being isolated from support networks or safety nets that would catch you. Okay. Oh. Well, okay, so like I said, age is a very big vulnerability. In 2016, Polaris reported that 74% of trafficking victims in the US were trafficked between childhood and age 23. So you can see in this graph, it's age at time sex or labor trafficking began, and there's kind of an upslant at 0 to 8, but then the biggest proportion is between 15 and 17 years of age. In 2017, an estimated 1 out of 7 endangered runaways reported to the National Center for Missing and Exploited Children were likely child sex trafficking victims. And 1 in 3 adolescents living on the street is recruited for sexual exploitation within 48 hours of becoming homeless. So according to federal law, any minor introduced into the commercial sex industry are human trafficking victims regardless if force, fraud, or coercion are present. I think this is important to state. If you work with kids, there's no exceptions to this. This means any person under the age of 18 who is involved in commercial sex, like prostitution, stripping, pornography, escort services, or other services, are automatically victims of human trafficking, deserving of protections under the law, not criminalization. It is important to know that anyone who has sex with a minor who is trying to meet their needs, they call this survival sex, is committing the crime of sex trafficking. The minor is a victim of a crime, the criminality lies in the buyer. And it's important to kind of go over some definitions here. The term commercial sex act is the giving or receiving of anything of value, like money, drugs, shelter, food, clothes, to any person in exchange for a sex act. Force, fraud, or coercion need not be present for a minor to be considered a victim of human trafficking. And it's good to note that sex trafficking is not prostitution or sex work. In sex trafficking or commercial sexual exploitation, there are elements of force, fraud, or coercion present, and the person cannot leave this situation safely. This is true for both adults and minors. So people being sex trafficked are prostituted people, not prostitutes or sex workers. And note, we've been talking about sex trafficking, but labor trafficking is another huge type of trafficking. You can see there's top 3 types of trafficking cases in 2018. And although labor trafficking is reported less, the idea is that it's just reported less, but it actually may be more predominant than sex trafficking. And this is kind of why, in general, there is so much more attention paid to the sex trafficking of minors, that where the media coverage is, and that's where law enforcement dollars are focused. So labor trafficking is kind of an afterthought, if a thought at all. So now we know the definition of human trafficking, the scope of the problem, who is at risk of being trafficked, and what is our role as a physician? We are among the top 4 fields where we are likely to encounter a survivor without their trafficker, as are law enforcement, school staff, and clergy. This makes us uniquely positioned if you're in the healthcare industry. I know some people aren't, but that makes us uniquely positioned to help patients access a safety net. And we're going to talk about healthcare's role in a minute, but for pediatrics especially, I wanted to share this data. So Prince William County Public Schools in Virginia became the first school district to put prevention education on human trafficking into a curriculum. They piloted a 90-minute education curriculum in the 9th grade, and the outcomes of this can be seen in the graph. So they started this in 2013, so they have 4 years of data. And after the lesson, they kind of wrote the number of students that came forward after the lesson, and then they calculated the % of students coming forward who were sexually assaulted, groomed, or victims of trafficking. And I think those numbers are way too high. I think about like my hometown, and like Prince William is probably similar, like 201 people or students were identified in 4 years. And so this is something that, pediatrics, like you think you won't see it, but you are seeing it, kind of maybe without even knowing it. So knowledge of human trafficking is generally lacking among healthcare providers. 63% reported that they had never received training on how to identify sex trafficking survivors. So thank you for being here. I think this lecture is kind of a basic lecture, but you'll get those tools as you move throughout the week. So thank you for educating yourselves on this. And a lot of providers will say, time is the biggest problem here. We don't have enough time to build the rapport necessary. We don't have the time to spend with patients. And that is a huge constraint. But there's kind of an argument to be made that, anyone that comes into the ED actively suicidal or with, a medical problem that's very emergent, we take the time to see those people and to care for them. And so these patients of yours are at risk. They're at risk youth. They could be trafficked. They have risk factors for trafficking. And so taking the time to talk to them and build that rapport and get this information and try to help them is really important. And this is also staggering. 88% of survivors reported seeing a medical provider within the year prior to their identification as a person who was trafficked. Most presented to emergency departments, about 63%, but a significant proportion presented to outpatient clinic settings. And these patients are coming in for a variety of reasons. 81% were coming in for sexually transmitted infections. Human trafficking survivors also reported the main barriers to inhibiting disclosures included feeling ashamed, that was 84% of people, and a lack of inquiry into the trafficking status from a healthcare provider, that was 77% of people. And healthcare settings provide an opportunity to identify survivors of sex trafficking, but interventions that are trauma-informed and patient-centered are essential to helping these patients effectively. So human trafficking is a hidden crime because you're not going to see it unless you're looking for those red flags. But it is happening in Richmond, Virginia. Bon Secours, the forensic nurses at Bon Secours were nice enough to share their statistics for the past 2 years. In 2018, they identified 28 patients. 25 were identified by law enforcement, 3 were suspected by a clinician. They were all hotel-based, all female, All sex trafficking, there were 2 minors and 26 adults, and they were all US citizens. Similarly, in 2019, they identified 26 patients. 23 were identified by law enforcement, 3 were suspected by a clinician. All were hotel-based, all were female, all were sex trafficking, 5 were minors and 19 were adults, and they were all US citizens. So if you're looking for this, in the hospital, you will find it, or in your clinic. It can look like domestic violence, it can look like substance abuse, it can look like running away, it can look like skipping school, or violating curfew, trespassing, disorderly conduct, possession of a controlled substance, hiding behind homelessness, lost and found reports, traffic stops. It can look like kidnapping, theft, robbery, assault and battery, drug addiction. It can look like all those things. So when you kind of see those red flags, that's when you should really start asking more targeted questions. And Hollywood tends to depict human trafficking as like a shadowy figure snatching and grabbing people, but that's not necessarily the case. It's not like the movie Taken. I think that's kind of the movie everyone thinks about. It's not always like that. And if you're looking for that kind of scenario, you may miss it. You may, not see the red flags. And patients, a big thing to note is they may not know that they're victims of a crime. This is most likely they've never even heard of the word human trafficking. Other reasons survivors may not know this is happening to them, maybe they have a disability, maybe they're too young to comprehend what's happening. Maybe they think their trafficker loves them or is their boyfriend or girlfriend. They believe it's an acceptable lifestyle choice, better lifestyle than the lifestyle they had. They may feel they deserve the treatment that they are receiving. Experts say they've met survivors who say they had no idea they were being trafficked until they saw that article in the paper or that show on TV, and they were like, oh, that's what's happening to me. So don't rely on your patients to self-report because they won't. They don't know. They don't necessarily think what is happening to them is human trafficking. They haven't even heard that word a lot of times. Okay. And then this is a big thing, people even like with domestic violence. Why don't you just leave? Why don't you just run away? And so there are like 5 major reasons. Number 1, they may not see themselves as trafficked, so why would you leave a situation if you don't, deem that you're in a problem? Number 2, they feel that they really love their trafficker, and they feel their trafficker really loves them. There's a fear of leaving because there's no safe way to leave. A lot of times they feel trapped. One survivor quote I'll read is, she said, "My trafficker used to say that if I left him or went back to another pimp, he would send a videotape of me to my dad. He would videotape me in a hotel room without me knowing with a John, and if I didn't do what he wanted, he would put it on Facebook or share it with everyone I loved." So that's a major reason why people wouldn't feel like they can leave. People also feel helpless or a lack of self-worth or shame. And those are kind of barriers for them to leave. But these are kind of some more examples. So then we're going to go through the force, fraud, and coercion, which is the model traffickers use to trap people. Force could involve forced drug use, confinement, physical restraints, deprivation of water or food. It could look like being scalded with hot water, and as a result, the survivor will suffer from anxiety or PTSD, having somatic symptom disorders or eating disorders or personality disorders, depression, coping substance abuse, or suicide attempts. So those are some things like as a clinician you could see in their past and maybe clue you in. They may show up with signs of physical trauma or have STDs or multiple pregnancies. I was actually on L&D last year during my AI, and there was a patient who had had multiple pregnancies and she was only 19, and a nurse was like, we need to ask her more questions. So we made sure she was in a safe space, asked the boyfriend to leave, and she said that she was kidnapped when she was 12 and forced to have babies at home and didn't know where those babies were now. And so this happens in Richmond, and we saw a nurse saw that red flag and asked more questions. And we found out she was in a safe environment now. So we were very thankful for that. But we asked those questions and we got some more information. And so that was kind of a red flag that we cued into. Fraud. So fraud looks like luring someone under false premise, tricking someone into a situation, only later to be like, so someone could be, someone's convinced to attend a new training course or to get a better job opportunity, only later to be passed to another person who commits violent acts against them or sells them to others. And so you can see that in this figure, the defendant relationship to victim pre-trafficking in 2018 criminal sex trafficking cases, and 30% were intimate partners. 28% were social media contact, but the highest was intimate partner. Coercion, this is the trafficker's primary weapon. This method is critical to a trafficker's success because they do not leave physical scars. So you can see some methods of coercion, such as withholding pay, physical abuse, threats of physical abuse, verbal or emotional abuse, sexual violence, physical isolation, cages, locked rooms, or barred cells. You notice that is like lowest on the list. So these other methods of coercion are used more predominantly. And then I was going to read, there's high levels of fear and continuous suffering are effective methods for the trafficker to gain total control. And these methods are extremely effective at forming these trauma bonds. And that's why it is common to see survivors return to their trafficker even after escaping. Survivor will return to his or her trafficker an average of 7 times before finally deciding to leave the trafficker for good. And I think we're going to have a lecture on the intersection of intimate partner violence and human trafficking, and that's a similarity that can be seen there. Other kind of phrases traffickers could use as coercion, like, I'm going to show these photos to your pastor and your parents if you don't do as I say. I'm going to call immigration authorities if you complain again. I'm going to tell your family what type of work you're really doing. Just kind of those phrases that they hear over and over and over again. And the health consequences of human trafficking are dire, far-reaching, and long-lasting. A lot of people will suffer from mental health disorders, anxiety, PTSD, substance abuse. And so those are kind of resources we need to make sure people have in their back pocket are mental health resources. And you suspect a patient is being trafficked. What do you do? And this is kind of a basic ask permission every step of the way. This person's identity was stolen from them through violence, and their belief in their independence was destroyed through fear and control. So it's fundamental that our interactions with them give them back their voice and control. And it's really important that we do that for their healing and rehabilitation. And so it's very important to ask permission every stage of the process. Like, where do you want to talk? Is this a comfortable environment? Would you like someone to leave the room? Just be very mindful that giving them all the control in the situation. And use interview techniques that build trust, rapport, promote autonomy, respect, and agency, so they feel like they're making their own decisions. And we're taught this in medical school, but I think it's just important to, remember this is a situation where those tools are really, really important. Make sure the meeting conveys that this is a safe space. They have freedom to participate in their own care, that they are vulnerable but not helpless, and have them partake in the decision-making process to empower them to find their voices again that they lost. And shared decision-making will help them regain that control and autonomy and their voice. You may be the only person that ever tells them that they have worth and hope for a better life. So that's a very important role that you have in this. Our role is to recognize the signs of exploitation, treat the injury, illness, disease, maybe an STI, maybe a broken arm, and educate the person on how to stay healthy and how to avoid re-injury. It's not about trying to make them leave their trafficker, because that can actually be very, very dangerous if they're not, they don't have plans in place. It's more about kind of empowering them to make that decision on their own when they're ready. And just a note about, for the healthcare providers, there are ICD-10 codes released in 2018. And this coding system is important because it can help in gathering this data that we don't have. If we put it into the computer system, that becomes a data mine, a data point that we can use to help guide our understanding of the scope of the problem across the United States, and to guide our clinical management strategies in the future to follow these patients long term and see kind of what helped them. So that's why we kind of wanted to give a shout out to these. If you ever need to use them, they are there. And the number of cases being reported every year is increasing. And the only way you can help someone is to call when you are suspicious. If you see something, say something. This is the National Human Trafficking Resource Center hotline. And it's purposefully supposed to be easily remembered. So if a patient comes in and they're like, it's not safe for me to have a number on me or in my phone, you can have them practice this and remember this number. 1-888-3737-888. And they're toll-free 24 hours a day, 7 days a week. Law enforcement can't fight this crime alone. It's too pervasive, it's too covert, and we are, as medical providers, as clergy, as law enforcement, as school teachers, we have the ability to identify patients, identify these people, and give them the resources that they need to make their own decision about what they see, going forward. If they want to leave, if they need, STI testing frequently or something, we need to be on the forefront of this. So thank you for coming and learning about this. And I don't know, I just think it's wonderful to see so many people here today learning about this. And then questions. I may not be able to answer all of them, unfortunately, but anyone have any questions that I can, and Faye will help me, Cheryl will help me. Anyone? Yeah.
On one particular slide, I noticed that you said that when they work in like strip clubs, they prostitute,
Yeah.
they are victims of human trafficking.
Yeah.
What about if a youth is prostituting, but her clients, I would guess it's called, are other youth? Is that still a form of trafficking if somebody is not over 18?
If the person, so the question is, if someone was under 18, a minor, but they were being sold to another minor, like
yeah, if she's selling herself to other minors and there's nobody coercing them or anything like that, is she still
Interesting.
a victim of trafficking, or is she just like
Yeah,
a high risk?
Force, fraud, and coercion doesn't have to
be present in someone under 18, I would say yeah, automatically.
So even if it is with other minors?
Yeah, because it's technically, that would be something like survival sex, like selling, for maybe like shelter or food or something to meet their needs. Even if they're selling themselves to another minor, I think it's still, and Faye, maybe you know more about this.
So survival sex, the criminality lies in the person buying that sex act from the minor. It's not the minor's fault. It's not, the minor is not the criminal. The minor is a victim.
Yeah, no, thank you.
So,
Yes, Cheryl.
thank you for a wonderful overview.
Thank you.
But I'm going to come up and
Yeah, no, go ahead.
say something.
You should be on.
That I, last month in a national conference in California for the simulationists across the country, and we debuted the human trafficking education module for the medical students here that we developed. And somebody came up to me afterwards and reminded me, because I only had one slide at the very beginning and I didn't emphasize enough as a nurse, and to say that if at any point during this symposium you have concerns or you're feeling uncomfortable and you feel like you need to reach out and have support, we are here for you. So please do that. Some of this content can trigger some certain feelings that may not be pleasant for you, and we just want you to know that because the same thing happened last year when we had the symposium. And so we just want to be sure you know that we're here to support you. And if you don't feel comfortable talking with us, we have many nurses, some in the room, and others here at VCU Health who are willing to talk with you about anything. So I just wanted to sort of emphasize that before we go any further this morning.
Yeah.
Thanks.
No, thank you. Yes.
So I don't know if it's time for comment.
Yeah, no.
One thing to also recognize with
Do you want the mic? Here. Sorry.
Okay, now I'm more nervous. One thing to recognize with anybody that has been a victim of trafficking is to recognize that they might have what is called the Stockholm syndrome, and that's literally getting attached to their perpetrators or the person that's using them, and could be an element of fear, but also an element of, despite this, I survived, despite this, that becomes the love language, kind of. And if you understand that that is what they're going through, you kind of become less judgmental because you understand that's what's going on psychologically. And maybe it's something we're going to talk about, I'm not sure, later on.
Yeah.
But it's something to read up about the Stockholm syndrome. It's really, it's like an attachment thing. And to a point where they might actually protect the perpetrator from anybody because they fear, the fear of losing that person becomes an element of a bigger thing than just, yeah.
Thank you. No, thank you for sharing that. That's very true. Yeah.
Anybody else? Hello, hello?
I think it's this down here.
Oh, hello? Oh,
Oh, the mic's on the table. Yeah, that's true.
Hi.
Hi.
You had a slide up there about Prince William School District
Yeah.
having this training. Is it a requirement that all school district personnel, teachers and guidance counselors and all that go through any training for this?
So they have wraparound services. Faye sent me the email about this, if you want to talk about it more.
yeah. There was a 2012 mandate, unfunded mandate for schools to address this issue, but not all school districts are because it was unfunded. There's only a couple of school districts that have prevention education in their curriculum. But Prince William County, they built their program from the ground up, and they trained every single staff member before they even dropped this curriculum into the 9th grade. Okay, so everybody was ready. And they also provide their own wraparound services, which I think is the most ethical thing to do. It's not like you're going to call DSS and CPS and ship the student out of the system. No, they have their own wraparound services and keep the child within the school system. So it's actually the only school district here in Virginia that's doing it this way. And I think it's the most comprehensive and the most ethical way to do it. Other school districts, they do have prevention programming in different subjects, like in maybe history or family life, or in different subjects they talk about it. And I don't know what their impact data is. They don't want to share it. They don't want to share how many kids have been identified, how many are coming forward. So actually, Prince William County is the only county that will share their data. And as a matter of fact, the Virginia Department of Education, they are creating a statewide curriculum based on Prince William County's curriculum. Okay, so that is in the works. And I think once that's passed, schools will have to address this, because there are kids going to school every day while being trafficked, seriously.
Northern Virginia, these kids are going to meet their pimp, are being bought and sold after school, coming home, eating supper with their families. Okay, so it's a huge problem, yeah, in the schools. Thank you. Anybody else?
Thank you.
Anybody else? I'm a nurse. Anybody else? Social worker, nurses? Can you just raise your hand? Can everybody just look around the room and see the people who are raising their hand? Because we would be very happy to talk with you privately if anybody has a concern or question. Okay, just find one of us. And this is the table of medical students here. They are also very trained in trauma-informed care. Thank you.
I'm just going to say that there also might be mental health workers here.
Oh, yes.
Yeah.
Who's mental health? Yay, okay.
Awesome.
We're
Wonderful.
also available for that same thing.
Awesome.
As that,
Thank you.
we've got training in that as well.
Awesome.
Awesome.
Thank you for being here. So we have a quick break before the 10 o'clock lecture. You can go out and get bagels and eat them out there, and get coffee and refreshments, and the bathrooms are over there again. Thank you, guys. Yeah, all the lectures are in this room, and then the breakout sessions, we'll bring this down in the middle to make 3 rooms, okay? There's a side room as well.
All right, we're going to get started with our second session of the day. Just a quick announcement for those who are just joining us to make sure you fill out that pre-survey that you got initially when you walked in. I know it's a little bit of a hassle to keep track of all those papers, but it's really important for the work we're doing here, so really appreciate it. I'm Sarah. I'm one of the medical students here. If you have any questions, let me know. I'll try to direct you in the right direction. But today I have the pleasure of introducing Hannah Rack. She's a fourth year at VCU School of Medicine here. She plans on pursuing a residency in family medicine. She grew up in Northern Virginia and earned her bachelor's at Washington and Lee University in Lexington, Virginia, where she worked with survivors of intimate partner violence and studied the effects of physical trauma on mental health. She has a passion for serving survivors of human trafficking and for helping to educate the public about this often misunderstood issue.
All right, good morning. So as Sarah mentioned, I'm Hannah, and I'm going to basically be building off of the lecture that we just received from Caitlin, which was a solid foundation of what human trafficking is. So if you're anything like me, when you first learned about human trafficking, you were very surprised. There were a lot of things that you may have misunderstood, many myths or misconceptions that you may have had about this topic. And so what we're going to do today is talk a little bit about what those things are that you may have come to understand but may not be totally accurate. But then we're going to discuss how these misconceptions aren't your fault. First of all, you're not alone. Most people hold these misconceptions. And second of all, there's a reason you think this way. And that's because the media has portrayed human trafficking in a very specific way that perpetuates a lot of these myths. So that's going to be what we're going to be talking about today. All right. So we're going to be busting some myths. All right. So if you didn't already hear this fabulous presentation in the previous hour from Caitlin, what would you have thought human trafficking was? Shout it out.
Smuggling.
Great point. Anybody else?
Yeah, they were right when she said it was like shady back with like trucks full of people. And,
Yep. Shipping containers is something that we hear a lot.
Yeah.
What else? Other countries? Exactly. Anything else? Good point, always gang related. So where would you have heard about human trafficking before? What resources would have introduced you to this topic?
Law and Order, SVU.
Law and Order, SVU, Lifetime movies, exactly. What else? Taken, Taken 2, Taken 3. There are a lot of them.
Movies educating us about human trafficking. I saw one called, I think, Hard Way.
Hard Way, okay.
Yeah, and it was about human trafficking, young girls, and you know the police and them was a part of the bad guys.
Yep. So there are a lot of really dramatized versions of human trafficking, and even the way the news portrays it can sort of hint at some of these more dramatized versions of this really complex and convoluted topic. So that's going to be what we end up talking about right now. So just a couple words on words. So you're going to notice that the way that I construct some of my sentences is kind of convoluted. I'm going to say things like future survivors or people having been trafficked. And that sounds really awkward coming out of your mouth, but I'm making those choices deliberately. And the reason that I'm doing that is using the words victim stigmatizes the individual. In fact, we're kind of moving away as a society from using the word slave to using the words enslaved people. And the reason that we do this is because slave is a noun. It kind of encapsulates the entire person, saying all you are is a slave. By saying someone is an enslaved individual or an enslaved person, they're a person. This is just a descriptor of something that happened to them. So you'll notice, why is she saying it that way? That's why. All right. So we're going to start off by talking about some of those myths and misconceptions as identified by Dignity Health, which is an organization that teaches healthcare providers how to provide trauma-informed care to individuals who have been trafficked. All right. So the first of these is that human trafficking only happens overseas. We know that's not true. You can see on this map, human trafficking has been identified in every single state in the United States. Only foreign nationals or immigrants are trafficked in the United States. Someone was mentioning that this is an international problem. That's sort of the perception that you have. That's definitely perpetuated, and that's something that a lot of people believe. Even in the US, they're undocumented immigrants. They're not US people who are being trafficked. But we know that's not true. In fact, 23% of people who were, of instances that were called into the hotline, 28% in 2016 were related to individuals, American individuals who had been trafficked. Human trafficking and smuggling are the same crime. We talked about that a little bit too. It's not the same thing. Smuggling is a violation of international borders. Human trafficking is a violation of a person, an individual's human rights. Those are very distinct things. Sex trafficking could never occur in a legal location such as a strip club. You would be surprised how many people think that this is true. It's not. Regardless of the location or the legality of the actual place in which this human trafficking is taking place, any person induced to perform commercial sex through force, fraud, or coercion is a victim of human trafficking, or in our case, a future survivor of human trafficking. Anyone engaging in prostitution is doing so by choice. No, that's not true, but it's really, really important to recognize the difference between sex work and human trafficking. They are two completely distinct entities. Unfortunately, they often get intermixed, especially in the way they're portrayed by the media, and it is really difficult to parse those things apart. I'm not going to get into too much detail about that and different resources that may be available to sort of parse those two different ideas, but I have lots available. If anyone wants to come up after the presentation, I'd be happy to share those with you. Victims of human trafficking will reach out for help. As we've identified, that's very rarely the case. Kind of some of the things that we were talking about with Caitlin. Survivors don't often identify themselves as survivors or future survivors. They may not realize that they're being manipulated or exploited, or if they are, what we were talking about before in terms of that Stockholm syndrome, they may have a relationship with the person who's trafficking them and want to protect them, and even if deep down they recognize there's something icky or wrong with the relationship, they're still going to protect it. In addition, foreign nationals, many of whom are being trafficked, although there are many domestic Americans who are also being trafficked. They may not speak English, and they may not know or trust their rights in the United States and be able to identify that those rights are being violated. Only women and girls are sex trafficked. No, we know this isn't the case. Men and boys can also be trafficked. Traffickers often target young men and boys, especially those who identify as LGBTQ. And we're going to get a little bit later into the specifics of that breakdown based on some Polaris data. Child sex trafficking could never occur in my community. We know, unfortunately, that this is not true. Every single community that Dignity Health serves has identified an instance of child sex trafficking. All sex traffickers are stereotypical pimps. We were talking about how the media typically portrays human trafficking as a shadowy figure coming out and grabbing someone and whisking them away. We know that's not the case. This is particularly stigmatizing data, but anyone can be a trafficker, including grandparents, parents, close friends, family members, neighbors, people that the people who are being trafficked trust. So it's incredibly important if you're acting as someone who's going to help and benefit someone who's been trafficked to allow that individual to identify sources of support on his or her own and not assume that a friendly relationship that you might perceive a father or a mother or a grandparent might be a source of support, because they in fact may be the person doing the trafficking. Human trafficking refers only to sex trafficking. No, there are two different types of human trafficking under the human trafficking umbrella: labor trafficking and sex trafficking. In fact, as Caitlin alluded to in her presentation, labor trafficking is more widespread than sex trafficking. Again, because it's a lot more difficult to identify, even more so than sex trafficking, it often goes unreported. But data has demonstrated that labor trafficking is more widespread, especially in the United States. This is an interesting one. You may have seen some memes on Facebook over the past couple of days or across the internet. Sex trafficking rises around the Super Bowl. It does not. Polaris has actually released a numerous statements saying Human trafficking on the date of the Super Bowl is the same as it is on every single other day of the year. Commercial sex may increase around big sporting events, but human trafficking does not. This kind of highlights that difference again between commercial sex work, and human trafficking. They're two distinct entities. Of course, it's something that we should always be vigilant about, but it's not something that we need to be specifically vigilant about around the Super Bowl or these large sporting events such as the World Cup. These myths have been busted. Everyone feel good? Yeah. Excellent. All right. So what we're going to discuss is a little bit about why public opinion matters. We know that a lot of people share these myths and misconceptions, these false beliefs about human trafficking, but why does it matter that people have this wrong idea about what this issue is? The first is, if people understand what human trafficking is, it can decrease the demand. We know that economics works on a system of supply and demand. If there's less of a demand for individuals who are selling themselves and have undergone sex trafficking, or individuals who have gone through force, fraud, and coercion to end up in an environment in which they are working in an unsafe environment or an unfair environment, will decrease the demand if people are able to recognize that and choose not to hire people who are going to do that. It can also impact the solutions. The most interesting thing about all of this is that in our democratic elected system, the solutions that are brought forth by the government are going to be dependent on the solutions that we bring forth as a people. And in fact, the more salient the issue is to the public, the more clout that the public has over that discussion, the more force they have to drive that discussion to have a specific solution in terms of human trafficking. Does that make sense? Power to the people is basically the gist of it. So how accurate is public opinion? If you're anything like me, you held a lot of those myths that we discussed at the beginning before you learned about human trafficking. I thought that human trafficking increased over the Super Bowl. I had seen that myth over social media over the past couple years. I thought that was true. I was very surprised to learn that it wasn't. I thought that was mostly women. I thought that it was mostly sex trafficking. All of those things, as we've already established, are not true. But most people typically believe those things. In fact, I've got some numbers here for you. More than 90% of people think human trafficking always refers to a female future survivor. 71% think human trafficking is the same thing as smuggling. 62% think human trafficking requires threats of physical violence, as we've established force, fraud, and coercion. Those are kind of our key words in regards to adult human trafficking. More than half of it think that it requires movement across borders, that whole smuggling thing that we were discussing. But on the other hand, there's some aspects of public opinion that are accurate and are perpetuating good ideas, correct ideas about human trafficking. For example, 78% are aware that pimping of a minor in any form is a form of human trafficking. 79% know that human trafficking is still the case if a person entered a country illegally on their own will, undocumented immigration, and then were trafficked once they entered the country. That still means that they are a future survivor, that they have been trafficked, something has been done to them, even if they are the ones who instigated the move across a border. And in general, people think that sex trafficking is more common in the United States than labor. I definitely held that belief, and we're going to get a little bit into why that is, that most people think that way. So here is a really interesting chart from a Department of Justice study in 2016. And basically, this tells us that, in general, people want the most government intervention in very specific types of human trafficking. As you can see on this x-axis down here, we're describing different types of individuals who've been trafficked: minors versus adults, males versus females, US individuals versus those who are foreign-born. And you can see the people that they want the most government intervention about are going to be minor, male, US citizens. Part of the reason for that is the type of story that the media likes to perpetrate. That's the one that people are most excited about and get most engaged with, is that type of story, that narrative. You can also see, unfortunately, one of the lowest points on this graph regarding the amount of involvement that people feel like they need to have in terms of human trafficking is in regards to adult women who are US born. Unfortunately, that's a large portion of the demographic of people who are being trafficked. this tells us a little bit more about why media matters. This is real data, again, from that same study by the Department of Justice that tells us that when someone is presented with a public service announcement addressing human trafficking, their likelihood of calling a hotline or having a conversation with another individual about human trafficking increases pretty significantly. In general, people are more comfortable calling a hotline. They feel like that's more of their duty than to share this information with friends, family, other ones in their community. And it's also really interesting. You can see those highest peaks. The highest peak is related to emotion, and we'll get a little bit into why that is later. The next highest peaks are related to facts, and it's the next highest peak in those three highest peaks. The next highest peak is related to taking an action, a specific action, a call to action in regards to human trafficking. So here, this is your healthy media diet, or unhealthy, depending on how you think about it. And although these are all social media platforms, we're actually going to be discussing more traditional media platforms, and we can talk about social media in a little bit later. We've got the power of the media. So this is the first image that pops up on Google when you search human trafficking in Google Images. What does this image make you feel? To buy someone? Exactly, that she's for sale?
It's anonymous. They're not a person because you can't see their face.
Exactly. There's something very interesting about the fact that it's very hard to see her features. What else? What else do people see?
I thought a little bit about ethnicity makes me think like, oh, this is something that's happening way far away from me, but not somebody who's like blonde and green eyes right next door.
That is a great point. Someone who doesn't necessarily look like you. What else? She's resisting. Great point. Great point. Yes? That she's owned by someone, that barcode. Yeah. She doesn't have any clothes on. Anything else? That she's an item, not a person. That's a great way to encapsulate the whole idea. So these are...
She's hurting, she's crying.
She is. She is. She has a tear running down her cheek.
When there's a barcode, if you don't like it, you can return it.
Wow. That is a really powerful statement. I don't know if everyone heard that. She was saying if there's a barcode, if you don't like it, you can return it. This woman is truly a good. She is a commodity. She's not an individual. So, switching gears, a lot of people mentioned Taken, and you would be surprised, a significant portion of law enforcement professionals identify Taken as one of their main sources of understanding for human trafficking. Pathetic, but true. So as many of you know, movies like Taken, Eastern Promises, I believe is another one, Blood Diamond, Crash, all of these perpetuate this idea of otherness in regards to human trafficking. They amp up the drama and sort of sensationalize what's going on. And they basically follow what we describe as a victim narrative, very much a damsel in distress. In this case, Liam Neeson has to go in and save this woman. She doesn't really have much agency in this situation.
There's only one of her.
There is also only one of her.
There's only one that matters as opposed to...
Exactly. He has a personal relationship with her, and that's the person that he feels like he needs to save. It's not on a systems-based level to think about how can we stop this thing from happening. Some of you may be aware of the fact that Ashton Kutcher has this major platform against human trafficking. He and his former partner, Demi Moore, they've actually testified before Congress. They've been a member of this United Nations panel in Office of Drugs and Crime. They have a fantastic organization actually called Torch. I'm sorry, not Torch, Thorn, an organization that combats human trafficking specifically online. Interestingly enough, the way that he and Demi Moore kind of got into human trafficking was a documentary about human trafficking in Cambodia. And they were totally and utterly baffled by the fact that human trafficking actually occurs on US soil as well. And so they started this organization, which actually has been doing some fantastic work. So they're using their platform for good in this very positive way, but at the same time, you'll notice he's using words like girls. We know that it's not specific to young women and girls. This is a more widespread issue. A lot of what he discusses on the Thorn website, I say that it's Ashton Kutcher, but his whole organization is geared toward children specifically. And while we know that children are a significant portion of the people who are being trafficked, they're not everybody. And they're frankly not even the average individual who's being trafficked. This is Mira Sorvino, who's another actress. She created this, I think it's a limited series on Lifetime. I don't know if that's one of the, is that what you were referring to? With Donald Sutherland. There's been a very interesting series of articles about this particular piece. One review states, it happens to expose vast amounts of flesh in the process of educating the public. They describe it as exploitation about exploitation, which again comes back to this idea of sensationalizing the story and making it something that people can kind of hook onto, but is also fun to watch, which is not really an accurate portrayal of what human trafficking is. So what is America's most trusted source of information? We'd like to think it's someone like Ashton Kutcher and Demi Moore. It's not. Americans have identified that news resources are their most trusted source of information. And specifically, I know that we can look online and we can read articles and we can watch YouTube videos. What I'm specifically talking about is sort of larger news conglomerates, such as the New York Times and the Washington Post, and larger television networks such as CNN. That's what we're going to be focusing on because that's where most of the information is coming that is then distributed on social media and YouTube and other forms of internet news. So this is a very interesting article that was published in 2011 that kind of demonstrates the amount of information that has been out there in terms of news articles on human trafficking. This, I believe, is specific to the New York Times and Washington Post, but you can see in 2000 there was a major event of some sort that made all these different news organizations really excited about human trafficking. And that event happens to be related to the United Nations publishing this major report on human trafficking, and that kind of brought the issue to the forefront in the year of 2000. But you can see it's kind of growing and growing and growing. This is really, really popular, definitely a hot topic. But what are they saying in all of these articles? So in this review of all of the New York Times and Washington Post articles from 1980 to 2006, kind of what was described in that graph is that big uptick, little petering out, but then a pretty major spike there around 2000. Less than 10% of these articles actually cited a primary source. So you'll remember in English class there were tertiary sources, secondary sources, primary sources. Primary sources are the ones who are first-hand accounts of an event. So in this case, people who are directly related to human trafficking, who have experienced themselves or have played some role individually. Only 10% of articles had individuals such as that. Less than 9 used an academic or policy analysis to kind of get multiple points of view on the issue, to be a little bit more objective. And 50% of all news coverage did not discuss causes of human trafficking. So you can kind of get the sense that it's very similar to that human trafficking Lifetime story where they're trying to throw something at you to kind of get your attention and be, oh, this is a very interesting story, this specific instance, but they're not really giving you many details that are specific to what's actually happening in human trafficking in fact. And most importantly, very few of them posed a potential solution. So again, the narrative is not really based on broader themes of what can we do about human trafficking. It's sensationalizing, oh, this is a very interesting thing, a hot button topic that we can just bubble up about. So this is a more recent review article of those same 2 newspapers from 2012 to 2013. This one was a little more interesting in that whereas the previous review article discussed that most of these kind of, what we were talking about, that this is an international problem, not a domestic one, many of these articles brought it back to the home front and discussed United States human trafficking. This one is particularly interesting. You can see the demographics over on the right-hand side. That's the actual breakdown based on the 2018 Polaris data. Those are the individuals based on those hotline calls who've actually been human trafficked. And you can see on the left-hand side that 39% of these articles mention children, which is a little bit of a disproportionate number. But as we saw in that chart, minors, that's what we're most excited about as readers. That's what we get most engaged in, want to have the most connection to, is male, minor individuals who've been trafficked. Many discussed female individuals. Many discussed both genders. very few discussed males. They also discussed that sex trafficking was in 70% of beat articles. So beat articles are kind of the investigative reporting pieces. And the media-initiated articles are ones like, okay, the UN presented this case, we're going to talk about it in this way. Interestingly enough, although very few, sex trafficking was most of these beat articles, again, because it's a little more sensational. Labor trafficking, as we know, it's a little bit more widespread. And sex trafficking were evenly divided in these media-initiated articles. So again, ones that have a more objective perspective, they demonstrate that both of these things fall under human trafficking. Interestingly enough, kind of coming back to this idea, the power to the people, that media matters, public opinion matters. During this 2-year span, safe harbor laws were passed in both New York City and Washington, D.C. during this time span. Safe harbor laws, for those of you who don't know, are basically specific to child human trafficking. It decriminalizes child prostitution, which, as we recognize, is kind of not an accurate term, and categorizes it as sex work and relates it back to human trafficking, basically meaning that kids can't be punished for having sold their bodies, that it becomes a crime, again, like we were talking about, based on the person who's purchasing the individual, not the individual, him or herself. So we've talked a little bit about newspapers, but we know most people don't read newspapers anymore. So we're going to talk a little bit about news on television. So way back when, in the good old days, we got quote-unquote objective news from the media. We had trusted figures such as Walter Cronkite, who would come on late at night and would tell us the facts of the day, and we believed him wholeheartedly. Then in, I believe, 1977, 60 Minutes became one of the more sensationalized news shows. People were really intrigued. It was a single story over 60 minutes, as the title suggests. Then in 1980, the cable news network started, and so began our 24-hour news cycle. And as we're all acutely aware, that's how news is now transmitted on television all the time. We have multiple different options of different stations that we can tune into. It's all news all the time. There's very little information that seems to actually be being covered in this amount of time. So this is a fascinating article published in 2010 that compared 3 different talk news shows on 3 different stations. So Lou Dobbs tonight, I know that he's currently, I believe, a Fox News anchor, but at this time he was working at CNN. Hardball with Chris Matthews, representing MSNBC. And the O'Reilly Factor on Fox News. And so this was trying to get sort of a span of the ideological spectrum while all of these different news organizations were discussing about human trafficking. Interestingly enough, all 3 programs have about the same amount of human trafficking coverage. It spans the ideological spectrum. Everyone cares about this issue. All 3 adopt an advocacy tone rather than an objective one. So in this advocacy tone, as we're going to talk about in a little bit, there was a lot of crime fighting sort of being the proposed solution across the ideological spectrum. This is the only way that we can deal with this. All of them included mostly white female victims and minority male offenders. Again, kind of perpetuating this myth that these are white, beautiful white women, young white women who are being snatched away and taken away by evil people, and it's frankly a kind of xenophobic ideology in regards to human trafficking. Interestingly enough, MSNBC's Hardball exhibited the greatest race and gender-based disparities in terms of guests, which may be surprising for those of us in the room who may fall more under that liberal side of the ideological spectrum. All of them also engaged in an episodic rather than a thematic frame. And what that means is kind of like what we were discussing before in terms of these news articles. Episodic is when you're discussing kind of extreme cases because that's what's attention grabbing, but not really discussing the overall idea of human trafficking. Instead, you're talking about the Jeffrey Epstein cases versus the everyday things that are happening, as Caitlin mentioned, 150 times a day, or at least those are how many calls are coming in. This leads to a distorted concept of what the crime actually is. And as we mentioned before, the answer to this problem and the way that each of these shows kind of describe it is that crime fighting is the only way to solve this issue. And what we found, this study actually found, is that viewers retain very little relevant information. Based on the way the information is presented, you kind of get good guy, bad guy, but you don't really get a sense of what the crime actually was. which is not terribly surprising, again, based on the way that this information is being portrayed. There's something called the law of opposites in crime reporting, which is kind of a snide way of thinking about it, but frankly, it's kind of somewhat true. Because of this sort of extreme cases that are being presented, the crime on television is basically the opposite of the way the crime actually is in reality. It's typically a lot more banal, a lot more under the radar. It's not the sensational stories that really tie up neatly at the end. Why is it that human trafficking is so difficult to report on? So, unfortunately, like Caitlin was mentioning earlier this morning, we have no idea how widespread this issue is. Reporting is terrible on this issue. It's a little bit better in terms of sex trafficking, but it is by no means good, and it's even worse in terms of labor trafficking. Sources can't agree. Even in the UN Office on Drugs and Crime thought that the number of trafficked individuals worldwide was half of what the US Office to Monitor and Combat Trafficking in Persons estimate was. So basically, even on this committee that we're looking to sort of be our information, even 2 leaders on that committee can't agree, and it's by a factor of half. This I thought was kind of funny. In one article, they estimated that 5.5 million children are being forced into labor worldwide, and then later in the exact same article, they reported an estimate that the number in India alone was 5 to 12 million. So basically, we don't know. We have no real sense of what these numbers are, which makes it really difficult to report on. The other thing that makes it really difficult is that human trafficking is a really, really, really complicated issue. It is the intersection of, as we mentioned, domestic and international issues, of crime, of human rights, of sex work, of child abuse. So many different people have a stake in this, and it's really hard to have a cohesive conversation about this problem.
We've also found, too, that some of the people that are fighting it the hardest are the ones that are engaging in it, too.
That's also
true. They
true.
have a stake in keeping it underreported.
Yeah.
Repeat so people can hear it.
Yes.
Oh, sorry.
No, absolutely. So what she was mentioning is that many people who are framed as the crime fighters who are solving this problem may actually be engaging in the purchase of sex or labor in this way. So they may actually have a different stake in terms of preventing this from happening. So because of this really complicated issue, there's something called framing that we do in media. Framing is basically making a really complex issue something that is easy to interpret. So there are different types of frames. There's the diagnostic frame, that which defines the problem. What is human trafficking? But as you can see, it's even hard to say exactly what it is. Prognostic frames, this is what proposes different solutions to the problem that's been defined in the diagnostic frame. And motivational frames, these encourage collective action. This is kind of that person buy-in that we're looking for. And as you might be able to guess, motivational frames is kind of what most media is doing. We're trying to get people to care about this issue, so we're going to sensationalize it and pick different individuals who we think that our readers are going to be more likely to engage with and care about. So we've got a little bit of a history of trafficking frames over time, starting off with the victim protection frame, which was very popular in the 1950s. It's kind of self-explanatory. It was sort of the damsel in distress mentality. In 1960s and 70s, this human rights came into play. Instead of thinking of them as damsels in distress, they thought of future survivors as not victims to be protected, but individuals who should be respected. And now in the 1980s and today, we've kind of transitioned into this crime frame. Instead of placing the blame on this sort of systemic problem, we place the blame on individuals, individual traffickers and individual buyers, instead of thinking about why do we keep allowing this to happen on a grander scale. So these are trafficking frames over time. Another similar study to the one that we discussed in terms of the New York Times and Washington Post. This looks at more general media, but discusses crime articles versus those framing the issue as human rights issue. And you can see, although it ends in 2010, crime articles have far surpassed human rights-based articles. And interestingly enough, in that 2000 time frame, like I was talking about, that sort of inciting event to making human trafficking a hot-button issue, pressure language in resolutions proposed by government and UN organizations It changes, again, to be more crime-based, to say we urge people to take action in this way instead of being a little bit more like we need to investigate, we need to figure out what's going on in terms of human trafficking. So a little bit what we touched on before. This comes from, I can't remember exactly what newspaper, but one newspaper describing individuals who had both purchased individuals who've been trafficked and who had been traffickers themselves. And as you can see, the demographics are mostly males who fall from ethnic organized crime groups, especially those with extreme violence. These are often portrayed as strangers to the victim, which unfortunately we know is not true. They're often family members, friends, people that the individuals trust. And customers, interestingly enough, they were portrayed as either very rich ethnic buyers or deviant upper class, typically white men. Again, we know that this is not entirely true. Most of those demographics are untrue. And on the female side, on the side of the future survivor, we have this idea of the ideal victim. Someone who's virginal, who's beautiful, who's young, who doesn't deserve to have this happen. That sense of being someone who deserves or doesn't deserve to have human trafficking happen to them is kind of the most problematic part of this, because by saying it that way, it makes it seem as if there's some people who do deserve or deserve a little bit more than other individuals to have this happen. So kind of like in horror movies where there's the beautiful woman who is virginal and hasn't had sex before, and she's going to be the one to make it through the end of the movie. It's kind of a similar idea that we're perpetuating in human trafficking. There's also an overrepresentation of simpler forms. I know simple is not necessarily the right word, but things like someone physically hurting someone else, that's going to be the means of force. But we know that fraud and coercion can look many different ways, and it can be a lot more subversive than that. It also, as I mentioned, promotes little sympathy for people who've broken the law, people who have crossed the borders illegally, people who have engaged in sex work prior to being human trafficked, especially those who've immigrated, who have engaged in sex work, who've run away, who've engaged in drug use. If you're not that ideal victim, we shouldn't have to give you our sympathy, and that's not okay. The impacts of these human trafficking frames. Legislators think of these frames, and they end up treating survivors who are not seen as the ideal victim more poorly than those who do fall under that category. And that's an unfortunate truth. As I mentioned before, some police officers admit their knowledge of human trafficking derives mainly from Taken, of all the possible sources of media from that film. That's unfortunate. So in response to all of this, the UN has proposed a number of solutions for reporters and for other media individuals who are investigating human trafficking. Some advice that they give is to encourage reporters to react first as human beings. So when you're engaging with someone, to act as a human being, to show sympathy, to allow that person to tell their story, and then edit the story with more of an eye toward the audience and being sort of fair-minded and objective, but make sure that you're engaging with the person in a humanistic way. And along those lines, you always want to make sure that you get consent, especially from survivors, if you're going to publish anything about them, even if it doesn't really include information about them. If you don't think it's identifying information or it's not an image, they still should have their consent, but especially in terms of images. They should also be explained the different risks and benefits to having this publication come out. And they should also be given resources, like the ones that we were kind of discussing, a safe space to engage with healthcare providers or other people who might be able to help them process. Because likely having this conversation is going to re-trigger, they're going to re-traumatize these individuals. It's hard stories to have to tell. And their most important sort of the summation of this UN Council was journalists need to consider human trafficking as a composite of many serious crimes and denials of rights. Recognize its link to migration, to labor, to gender, to health, to human rights, and to criminal justice, and take the time to accurately represent what the survivor is saying. So in general, remember those three frames that we were talking about and how we're in this motivational frame? We still think that we need to convince people that human trafficking is a terrible thing, when frankly that's not true. President Trump held not a symposium, a summit last week focused on human trafficking. And in fact, in his remarks for this event, he mentioned the fact that everyone's kind of on the same page. This is a bipartisan issue. People agree that it's bad. It's what we're going to do about it that we're still kind of working the kinks out on, that there are lots of different perspectives, many of which we haven't really heard. So switching from this motivational frame to convince people that this is a bad problem to more of this prognostic frame. What are we going to do about it? That is kind of where we need to move in terms of media portrayals of human trafficking. So where can you go for more information on human trafficking? I've now picked apart all these newspapers and different things that you can look up on the internet and things like that. So in 2017, the State Department reported on fantastic resources, fantastic examples of reporting on human trafficking. Interestingly enough, most of these examples are related to labor trafficking, which, as we mentioned before, was pretty much underrepresented in the media. So a lot of these are fantastic resources. The Des Moines Register, in particular, in 2009, that report led to the release of dozens of men with intellectual disability who were being abused and forced to work for 41 cents an hour in this very rural town in Iowa. It was because of this reporting that the law enforcement was able to make put the pieces together and release these individuals. The CNN Freedom Project and the Al Jazeera English Slavery, a 21st Century. These are both a series of different videos that you can find online and learn a little bit more about different perspectives. Many of those are more internationally based, but still really good sources of information. This NPR two-part morning edition piece is focused on fishing and labor trafficking, specifically in the seafood industry. There were a fascinating number of different articles specifically based on seafood industry, which is not something that people really knew too much about. That's a form of human trafficking on the open seas, to create an environment in which people are forced to work for little or no pay. In particular, these, in 2015, the Capitol News Service, in conjunction with the University of Maryland School of Journalism, they had this series of articles called The Brothel Next Door, Human Trafficking in Maryland. And through this reporting, they were able to sort of put together the pieces on 45 different human trafficking cases over the past 10 years, just around the Baltimore City area. So good work is happening. There are lots of good resources out there. We just need to take the time to find them. This is a fantastic book, Girls Like Us. I highly encourage you to look it up if you have any interest in this topic. It is a memoir, and basically, like what we were talking about, how often these survivors are being portrayed as damsels in distress, or people who are somewhat how other, or if they're one of us, it's to sensationalize the story and make us feel more sympathetic about them. Girls Like Us is a great memoir from the perspective of a survivor, talking about sort of her journey to being from future survivor to a current survivor, and developing an organization to help women who are similarly going through this process of transitioning from future survivor to current survivor. This article, The Girls Next Door, published in 2004, was kind of a major expose in the New York Times in 2004. There's some problems with it. It definitely sensationalizes the story, but it does a great job of discussing some of the systemic issues that are in place that perpetuate human trafficking. So it's a really interesting read if you have the time. It only takes about 15 minutes. Someone was mentioning Law and Order SVU. And the reason I have it in this section and not in the previous section where we were just kind of parsing apart the different problems with the way that human trafficking is portrayed in the media, well, yes, it's still an hour-long crime drama. It's still going to be neatly tied up in a bow, or if it's not, there's going to be some cliffhanger, some resolution of some sort, and obviously that's not the way that this issue works. But because it's been on the air so long, and because the individuals who are in charge of writing the show have taken the initiative to really understand survivor stories, there are many episodes dedicated to different forms of human trafficking. There are many different perspectives, and they're based on real survivor stories. And SVU actually partnered with the Polaris Project in terms of both fundraising and awareness. So Polaris, which is that wonderful organization that we use as kind of our main source of data about human trafficking, even they've identified that SVU is not a terrible place to learn. It's not a great place to learn real objective data about human trafficking, but it's a good place to get a little bit more of that motivational frame. It's a good way to get that buy-in in a way that's a little less biased than the way that we see it in the little 15-minute chunks on different news programming. They are making the effort, exactly. These are some documentaries, all of which are available for free online. The ones that I'm particularly excited about are Truckers Against Trafficking. This is a fascinating initiative, I believe it's nationwide, for truckers who are identifying human trafficking, particularly at truck stops, and taking the initiative to identify it and to do something about it, to report and to intervene when appropriate, and it's a responsible thing to do. I also really like the Frontline documentary, if that's something that you have an interest in as well.
Apparently UPS has a thing.
UPS?
UPS.
I was not aware of that.
They have a sex trafficking training. It's like, I can't remember the right now. I just read the article like 2 days ago. But they have a very specific group of drivers that get a certain training to be able to identify sex trafficking red flags.
That's fantastic. That's really interesting.
Last year, we presented the, was it American Airlines? Is that right?
Uh-huh.
Training for their staff.
Oh, wonderful.
They did a video on podcast.
Yeah, the
That's
UPS was
fantastic.
sponsored by the truckers. That was the basis.
That's very cool. So this last resource that I think is a fantastic one is this Coalition Against Trafficking in Women. This is a great place to find real survivor stories, real leaders, survivor leaders within the international and national community. It's a great place to look and hear a little bit more firsthand accounts of what human trafficking is and their journeys from future survivor to current survivor. And these are the many different articles that may be available to you if you have an interest. And again, if you do have an interest in learning a little bit more of that intersection between sex work and prostitution and human trafficking and how those three things are kind of portrayed in the media in positive and negative ways, please reach out to me. I have a number of different resources that I'd be happy to share. And again, you're going to see this slide a million times this week. I highly recommend just putting that number in your phone now or taking a screenshot of it, taking a picture, because if you don't know it, you will by the end of the symposium. All right, what questions does everybody have?
Is there a way to get, oh, I'm sorry, go ahead. I just want to know if you can get a copy of the slides. That's all I want.
Yes.
Okay.
And this is being filmed, so it'll be uploaded to my website so you can play it.
Did you have?
I think I bring one of the most different perspective because I'm from Southern Africa. I think, yeah, I'm from Southern Africa and I'm from Namibia. So in South Africa, what they've done is there's a documentary called Carte Blanche, and so they have episodes there where the real police officers are actually fighting against this, and then they speak the different languages so that victims can see that this is what they do. So they literally follow girls who are being trafficked, and then they rescue them, and then there's a whole documentary on how many people have been caught, especially foreign individuals who are so rich who buy the young girls, because you could see there's been girls, they are being trafficked because they're holding on to their child, and that's all they do. And so they've done a little bit of training with the shopkeepers in those areas.
Wow.
Like owners of Kruger, maybe here, or CVS or something. If you identify a homeless-looking child, just look for the signs. So it's a documentary that we kind of follow a lot, and it's so nice to see the officers being friends. Because at times the victims get to see officers like, if I speak to them, I'm going to get killed, or my child's going to get killed. So they portray them as they actually help us and not, enforcers, sort of, in a way. So it kind of makes it easier for them to reach out or to talk to someone to get help. So it really makes it really cool. So that's one thing that SA is trying to do that we are following as well. So maybe that should be something to look into.
That's wonderful.
Thank you.
And that's a really good point about having the buy-in of other individuals in the community. One of the other interesting things that a couple of these articles pointed out is the way that the media is portraying this. Because it feels so other, people are concerned about it, but they want the government to intervene. They don't want to have any personal stake in changing human trafficking and preventing it from happening. So that's really interesting that you do need some of that personal buy-in, because like the truckers, like American Airlines, we as individuals can be doing things in terms of seeing something and saying something. What other questions do people have? Oh, sorry.
Yeah. There was a study out of Minnesota, and they did a study on all the buyers. And what they found was that it was white, college-educated, middle-class to upper-middle-class men who traveled about 60 miles from their home. And it was before the workday, during lunch, and after work where they were buying sex. So it was primarily the white male, with the white picket fence. The Department of, was it Justice? They also did a study on their buyers, and it was the same thing. So you have to understand that, if there are people buying, this is never going to go away. If there's a demand for human trafficking, for cheap labor, cheap or free labor, or illicit sex, this is not going to go away. So what we have to do, we have to go upstream, right? We have to prevent this from happening in the first place by educating our kids, especially our kids, on how to recognize this crime, because if you don't know what this crime looks like, they're going to get trapped. A lot of these kids are getting trapped even before they know it, because that's how subtle it is. That's how deceptive these traffickers are, okay? So demand, demand, demand. We got to do something about the demand. International Labor Organization said that businesses can increase their profits by 50% if they use human trafficking victims, okay? And then for sex trafficking, you can get up to 100 to 1,000% on your investment by selling girls, boys, men, women, LGBT youth, okay? So it's extremely lucrative, and this is not going to go away. So it's all about awareness, awareness, awareness. Because we have the more people who are aware, the more people calling into this hotline, the more people who are complaining that they see it, it's going to drive police response. Police response is always driven by citizen complaint, right? So the more people who are trained to recognize this, call this hotline or call their local police, that's when action is going to happen.
Thank you. As a follow-up, I'd like to plug the organization I volunteer with, the Richmond Justice Initiative. Saturday afternoon, they are having a workshop, I think right in this room, where they're going to discuss our efforts at educating youth to recognize and avoid this. I think we've done approaching 40,000 kids that we've gone through the program, and they're high school students, but now we've even recently initiated a program for middle school students. So our staff, Joelle, will probably discuss that in detail. So I think she's very good and could learn a lot in prevention if you want to come Saturday afternoon.
Thank you.
And thank you for an impressive talk on that. I understand that awareness and education are the primary systemic issue. Are there other systemic issues that you'd like to highlight right now?
So interestingly enough, there's a lot of discussion happening in terms of, like I was talking about the motivational frame and the crime frame. There's a lack of interest, it seems, in the public sphere at this point. Everyone's kind of attacking this problem from the crime perspective, saying we need to track down the traffickers, we need to get the buyers, we need to nip that component in the bud. And there's not as much of an emphasis on what do we do with the people who have been trafficked, what do we do with the survivors. We need a significant amount of support with that. And in a couple slides, let me show you something. This is a major initiative that they're working on, especially at Polaris. In terms of social media and using that as a means, because many individuals who've been trafficked or still have access to their phones, even if it's limited access, and in terms of the way that opportunities to be trafficked, sort of that initial step in coercing someone, if we can highlight these on social media, as you can see the fourth comment down, Nick N, if we can have more of a sense of people sort of nipping it in the bud at this end, convincing people who would be survivors, would be future survivors, and to prevent it on this end. Kind of what we were talking about in terms of promoting, educating individuals in schools, attacking it from this end as well.
Education and prevention.
Education and prevention, but also that component of empowering women who are currently, or women and men who are currently in the position of being within the human trafficking sphere, because that's a major component of this as well. A significant number of people within the past couple of years who were able to transition from future survivors to current survivors did so because they were able to reach out to someone on social media. They were able to recognize that there was something wrong with their situation, and reach out digitally to someone who was able to help them with that transition.
Thank you.
Yeah.
Where does pornography fall in this?
Oh, yes.
Caitlin, there was a New York Times article on pornography. I have it, it's sitting on my desk, but I'd say in the last 3 months, it was pages long. I mean, law enforcement, they can't keep up with it anymore when it comes to child pornography or just pornography. Huge trafficking situation there. I don't know if you want to, but I'll actually bring that New York Times article. It was like 3 months ago, and I'll bring it with me tomorrow. But it's awful. I mean, they have live videos of children getting raped, okay? Gang raped, babies, okay? And people are paying for this stuff. I mean, the buyers are not just all male. There are some female, but it's predominantly males who are buying this stuff, okay?
Along those lines, they did a study. I've got this one.
Okay.
Sorry. Along those lines, they did a study of people and I think I showed a slide from that study earlier on in terms of the amount of engagement that people feel, and they identified that females are typically more concerned about human trafficking than males, and specifically males who have within the past year viewed pornography admit on this form to having viewed pornography or or have visited a strip club they recognize that human trafficking is an issue, but they do not have any individual or believe that there should be governmental buy-in on the issue. So we are kind of able to identify certain sects within the American populace who they may be more likely to actually be buyers or perpetuate the problem, but certainly they don't have as much of a strong interest in the issue. And typically they are white men, college educated, with a decent income. Was there one more question?
Could we have one last question here? Yeah, before we break.
I don't know if you'll be able to answer this, but with the Prince William curriculum, I'm wondering if they, as part of the curriculum, talk to the male students about the secondary consequences of, their sexual actions other than the prevention of trafficking themselves and, not engaging in it from that way.
I could actually ask that. Angela Alvarez, she used to work with the program. She actually helped build it. I will ask her and get back to you. Great question. So why don't we take a break? The next talk will be public health framework to fighting human trafficking, and that's when we're going to go upstream. We're going to move away from criminal justice as a solution because we can't arrest our way out of this crime. We can't. It's like playing whack-a-mole, right? So we got to go upstream. We have to see this as a public health issue. Talk about the social determinants of health. What is causing human trafficking to begin with? Poverty, homelessness. All that, we have to attack it upstream. So we'll have our speakers come in shortly and you can take a little break. Thank you so much.
Thank you.
All right, everyone. If we want to settle in, we're going to go ahead and start our third lecture of the day, Human Trafficking as a Public Health Issue. Now we have two speakers here with us today. The first one I'm going to introduce is Dr. Kelly Carlisle. She's an associate professor in the Department of Human Behavior and Policy in the School of Medicine here at VCU. She serves as the scientific lead of the Sexual and Domestic Violence Research Development Group in the VCU Institute for Women's Health. Her research focuses on public health approaches to violent prevention, and she has 15 years of experience working with domestic violence shelters, rape crisis centers, and other community organizations dedicated to preventing violence. And our other speaker is Alina Nakfi. She's a fourth-year medical student here at VCU. She's applying for residency in obstetrics and gynecology. She grew up in Northern California and attended UCLA studying physiological sciences. She grew interested in being an advocate for the fight against human trafficking after meeting Ms. Faye Chelmo, founder of Impact Virginia. She's a co-founder of the Students Fighting Human Trafficking Student Interest Group and is the outreach liaison for the upcoming Human Trafficking for this Human Trafficking Symposium. Sorry. All right, take it away.
Thank you, Sarah, and also thank you, Dr. Carlisle, for being here and for everyone who made it out this morning. So our presentation this morning is a little bit different, like Faye said, than kind of the morning session. So for those of you who weren't able to make it to the morning sessions, we have a very brief kind of introduction to human trafficking, but we're just going to move right into the public health and kind of the effects on the greater scale. And our goals today are to, first of all, define what even is a public health framework and how a public health framework and a public health lens can help with human trafficking as it does with other huge issues like the opioid epidemic, domestic violence, things of that nature, and how kind of all of these areas overlap. So that's our goal for this session. So again, let's talk a little bit about how human trafficking breaks down. So with everything, there is an action, means, and a purpose. So what are our actions? In terms of human trafficking, our actions are recruiting, they're transporting, they're providing, and it's obtaining and attempting. And these are the kind of pre-steps in human trafficking. Then what are the means? It's force, fraud, coercion. So this morning we talked about all of these different aspects and kind of the reasons why this is such a highly lucrative enterprise. The purpose. Why? So, and what is happening? So, like Hannah and Caitlin both mentioned, human trafficking is not just sex trafficking, it's labor trafficking as well. So, it's commercial sex acts and labor services. So, again, just to touch upon the scope of the problem, who are the people affected? Like we mentioned, it's not just people who are, young women in Europe who are kidnapped, like the movie Taken. It's bigger than that. It's women, children, it's men. Globally, about 27 million people are being trafficked, and about 58% of these cases globally are sex trafficking. And human trafficking is one of the largest criminal enterprises in the entire world. So it's about $150 billion business. And what we're comparing this to is things like gun trafficking, drug trafficking. Human trafficking is right up there with those issues. It's increasing, and unlike, guns or drugs, humans are almost indispensable to these traffickers. So the cost-benefit kind of payoff with this kind of business is huge. And just to get into kind of the statistics of what the criminal justice system has been able to accomplish, the Department of Justice brought, this data is, I believe, from 2017. The Department of Justice brought 282 human trafficking prosecutions, charged 553 defendants, and secured federal convictions against 499 traffickers, while the FBI initiated 782 human trafficking investigations and arrested 2,693 subjects. So though these numbers are great and they're improving, it's just not enough. That's quite frankly the point that, like Faye said before we started this talk, we can't just arrest our way out of this issue. So let's talk a little bit about the criminal justice approach. What does that mean? Who's involved in the criminal justice side of it? It's lawmakers, it's law enforcement. These are the people who are at the forefront of, like Hannah or Caitlin mentioned this morning, it's the law enforcement, it's us and clergy members and school teachers who are all at the forefront. So law enforcement, police officers, they are vitally important to completing their role in help eradicate human trafficking. And what are they doing? So they are identifying and intervening with at-risk youth. They are investigating crimes and identifying potential trafficking. They're identifying and recovering victims, reducing recruitment and demand for trafficking, arresting and prosecuting traffickers, which is very important because, again, we're trying to move to decriminalizing human trafficking. We are moving towards finding the source, finding the traffickers, and prosecuting the traffickers themselves. These are the offenders. These are the people who will, who are doing the coercion, the fraud, all of that. And lastly, they're seeking justice and restitution for victims. And an important thing to note here is Hannah definitely emphasize the lingo that we're using. We're using survivors. We're using people, who have been trafficked. Criminal justice approach and that criminal justice framework, which I'll get into a little bit more, kind of comparing the two. Notice that I'm writing victims here. Now let's talk a little bit about a public health approach. So what is a public health approach? So simply, it's recognizing human trafficking as a part of a spectrum of interrelated violence. So we're looking at all of these different areas separately, but we want to start combining those because there is overlap in human trafficking, in community violence, in elder abuse, in child abuse, sexual assault, and intimate partner violence. And we're very lucky that we will have talks later today and later this week kind of touching upon those topics as well, so I won't get too into those. But we also want to understand the ripple effect that human trafficking is causing and the mainly the effects of that trauma. And that trauma is going to be kind of presented and manifested in different ways, which again we'll get into. So we're also encouraging cultural specific preventions and intervention efforts. So culturally, we are in the generation of social media, and that is also being so hugely impacted on how human trafficking is viewed and how we can utilize human traffic or social media to help eradicate this issue. So now I wanted to talk a little bit about the differences in the systems of public health and criminal justice frameworks. So starting off with the criminal justice framework, this is a great slide to highlight the differences, but I do want to emphasize that though they are different, we still want to create kind of a synergistic effort between the two. So let's not kind of imagine these as two different entities. Let's imagine them as kind of working together, but just highlighting the different goals of each. So starting with the criminal justice framework. So the goal, uphold the laws of the state. We're seeing the survivors and or the people who have been trafficked as victims. They have a more defined time frame. It's more justice orientation. It's government-based, and their overall goal is to punish traffickers. So I didn't know this, but the kind of path to identifying a trafficker, identify someone who's being trafficked, it's a long-term thing. And just as it is for public health, it's also just as long for law enforcement. So these people are undercover. These people are going to to get a job done. So it's all something that
though it is a more defined time frame, it is very long term. So that's why it's important to incorporate a public health care prevention framework where the goal is to advance patients and population health as a whole. We're looking at survivors or people who have been trafficked as patients. It's a long-term process, maybe a little bit longer than a criminal justice framework. It's a population orientation, it's community-based, and the overall goal is to prevent harm. So changing gears a little bit, I'm going to have Dr. Carlisle touch upon the public health side of it, as although I have learned a lot through this process, I'll leave it to the expert.
Well, thank you. We will use those terms very loosely. So a lot of my background comes from sexual and domestic violence, and so much of what I'm going to say applies more to sex trafficking than labor trafficking, although there's certainly parallels. And obviously I don't like podiums. So the differences between much of the criminal justice approach and the public health approach is criminal justice is largely reactive. There are some proactive approaches, but public health tries to be a little bit more proactive. And so we start with the public health approach by just saying violence is a disease that affects the public's health. Hopefully we're in a place where for most of us that's kind of taken for granted. We accept that. But that was actually quite a radical idea. So back in the 70s, which maybe at least a third of the room, this is still our lifetime, any kinds of interpersonal violence, think about domestic violence, intimate partner violence, was largely viewed as a family issue. That was something that happened in the home. And then we started moving to, well, it's an interpersonal family issue with legal implications. If you think about the 80s, that was when we first got our terminology for marital rape. Before that, it didn't exist because we didn't have the language to name it. And it wasn't until more of the 90s, early 2000s that the CDC really started laying out frameworks for violence prevention and building out the National Center for Injury and Violence Prevention. And so one of the things we try to do is look at the points of connection, right? Because as Alina said, there's multiple underlying risk factors for things like sex trafficking, child abuse, intimate partner violence, all those sorts of forms of abuse. So to just take a step back and assume that most of you don't have a public health background, what does it mean to approach something from a public health lens? What is that public health model? So this is not specific to violence, but in general, any health topic, public health says the first thing you do is surveillance, right? You need to understand the prevalence, incidence, and risk factors associated with a health issue, right? So what is the scope of the problem? Who is it impacting? Then you want to identify the cause as much as you can, who's most at risk, and what are those potential protective factors, right? So not always thinking from a deficit model, but what are those resilience factors, protective factors that we can also try and build out. Once you understand the problem, why it's happening, you want to develop and evaluate programs, and that takes decades. We are still getting there with sexual violence. And once you kind of have an idea of what works, get an evidence base behind it, then you have to figure out how to disseminate and implement effective programs. So if you can imagine that we're still, have a handful of evidence-based strategies for sexual violence prevention, where we're at with sex trafficking. Thank you. So one of the frameworks within public health for us to think about risk factors in particular is the social ecological model. So the social ecological model talks about human behaviors and our choices are things that are not just a result of ourselves. It's not just what happens in the individual, it's our social relationships. It's things that happen in our communities, in society. So all health behaviors have risk factors at each of these levels. So if we're looking at something like child sex trafficking, you can look at individual risk factors like a history of child abuse, neglect, or maltreatment, right? So we know if you're mistreated in the home, you're going to be at a lot higher risk for trafficking, for a lot of different problematic forms of other ACEs, right, of adverse childhood experiences. Homelessness, runaway, or what are sometimes called throwaway youth, and LGBTQ youth, and a lot of times there's an intersection there. One of our local LGBTQ serving agencies has actually had to start an informal foster system because the youth that go into the system in Richmond are at so high risk of trafficking. And I think Alex will talk more about that later this week. Let's see. Stigma, discrimination, especially when you think about what maybe isn't the stereotype of who the victims are. So our children, right? I have a high school daughter, and she's very high risk, right? You think about the social media activity, but people don't think about kids still living at home who are being trafficked. But if they get tricked into a naked picture or something else and blackmailed, that social pressure that functions with teenagers puts them at risk, right? Because we've completely stigmatized any sexual behavior among teens. And so it makes it really easy to exploit that. When we think about relationships, so family conflict, disruption, dysfunction, if you're experiencing other forms of violence in the home, if you're witnessing domestic violence between your parents, it's affecting how you think about interpersonal relationships and what those scripts are for what love or companionship might look like, right? The community factor, so peer pressure, social norms, social isolation, gang involvement, under-resourced schools, neighborhoods, and communities. That's a lot of different things. So let's just kind of unpack that a little bit. Social norms and social isolation. And thinking about, where are the places for youth in our communities? Where are they spending their recreational time? Where are their safe places, right? Are we creating structures? This is kind of like a built environment approach. Are we creating safe spaces for people to play safely, to have recreation, but also to seek help and to seek services, and to do that in places where they live, on the bus lines, before we change our GRTC routes and make it harder for people in our housing communities to actually get to our medical services. All of those things create different risk factors. Underserved, under-resourced schools are really kind of politically correct, polite ways to say that, there are communities who have lived through historic racism that are still living through a structure of white supremacy and sexism, and that all of those things that we give these coded names to influence our environments and our communities and our risk. But we call it under-resourced, so we can feel better that if we put money on it, that it'll fix the problem. Societal risk factors: lack of awareness of commercial sexual exploitation, sex trafficking, sexualization of children, lack of resources. So, if you think about sexualization of children, it is so pervasive that most of us don't even notice it, unless it's an extreme example. If you have time, there's a documentary called Sexy Baby. It's exactly as disturbing as you would imagine by the title. And in fact, if you Google it, that's not likely the first search term. The first search term is likely to be some really disturbing Halloween costumes. And so it's a mother of toddlers as well. If you think about any affection shown between kids, oh, he likes you, the sexualization of relationships between children, the high-heeled socks for infants who can't even walk, and all of the comments that sexualize children, these all create a society that is conducive to things like sex trafficking, right? When we teach little girls, if a boy is pulling your hair or hitting you, that means he likes you. That's the scripts as we start young that say, okay, well, that's just what relationships look like, right? Lack of awareness. So does sex trafficking happen at VCU? So on the last campus climate survey, there were about 3% of undergraduates and 2% of graduate students who indicated they had been sex trafficked while at VCU. So these are students who have made it here. And if you look at the data, you can also see those students were likely to have 3, 4, 5 adverse childhood experiences, right? So that neglect in the home, seeing abuse, things of that nature. They made it here, maybe even made it to graduate school, and this is still happening. Right, so thinking about, again, those social structures that allow it, we are one of the top universities on seeking arrangements and for sugar baby, sugar daddy relationships. And so, yes, there was just another news article about that. We've pretty consistently been in the top 25 universities for that. It's fantastic framing. They talk about how you can network with individuals who are successful in their careers. And of course, being in arrangement relationships makes you that much more vulnerable to being trafficked. And so if you think about, anytime you have a university that needs a food pantry like we do and other sources like that, there's that economic need. And the most part for our students here, it's to pay for the, they're in the sugar daddy relationships to pay for tuition, to pay for food, things like that. If you think about the disproportionate burden to women and their vulnerability, think about the economic structures, right, and minorities. Why is it that we have such a high economic need? Is that influenced by our social structures? So this is how public health analyzes things. Okay. Yes.
What do you mean by VCU has a lot of students who are in those relationships, like with the top 25?
So I'm not sure the methodology of the survey, but Seeking Arrangements is the primary website, and they actually publish, because they're very proud of themselves, the affiliation of the top 25 universities. So I think part of creating the profile, because it's like a Match.com, but for arrangement relationships, and so you put what university you're affiliated with. So that's of the people who identify themselves, the colleges they're identifying at. That's there. Yep. I don't feel like I'm that old, but there's things like that that just kind of blow me away every day, like cam girls, things like that. Camming is very popular, so things that you do over webcams, ways to earn money, and it's complicated, right? This is not a straightforward, problematic thing, right? When you intersect third wave feminism, female empowerment, and the overall criminalization of sex work in the United States, it becomes really challenging to properly identify what is sex work, what is prostitution, what is sex trafficking. But again, someone like myself coming from a public health framework would look at sex work and say, okay, again, it's disproportionately women. Why don't we have access to careers that pay us what we need to pay to do something else? So it's a very complicated relationship, especially in this college population. And I would imagine that most of VCU, from a faculty perspective and administrative, that we're not even on our radar that there are people here being trafficked. Because when that 3% of undergrads and 2% of graduate students, that was separated out from people who are in an arrangement relationship. So that's not counting those. That's a whole other separate statistic. So public health framework looks at these social determinants of health. Social determinants means those things at the outer levels of the ecological model. Yes, they interplay with the individual and the interpersonal relationships, but we want to move away from always focusing on the individual. I mean, we have a history of doing that in public health across health choices. Why are you smoking? Why are you, doing XYZ behavior? You need to change. But recognizing, social determinants of health are the things that shape where we live, where we work, where we play, right? So how can we shape our communities? How can we shape the environment? So looking at housing, looking at economic opportunities, looking at our environment. There's a lot of research coming out now in sexual violence on college campuses that looks at the built environment. If you don't have anywhere if you want to go back to a dorm room and talk with your friends who you just met at a party, the only place to sit in most dorm rooms is a bed. Sitting on a bed with someone can be interpreted as a little bit of, well, that's my foot in the door for consent, right? So just the way our structures are set up are not conducive to prevention, right? So when we talk about preventing violence in any kind of prevention, we have primary, secondary, and tertiary. Or we love the upstream, downstream approaches. So primary prevention talks about stopping violence before it happens. So things like teaching what healthy relationships look like, right? If you think about our K through 12 environment, we focus a lot on telling kids not to have sex, but we don't talk to them about what does a good relationship look like. How do you talk about what you want, where your boundaries are, what does consent look like, all of those things, whether it's leading to sex or not, how do you feel respected in a relationship? Secondary, the immediate response to violence. So this is where the medical environment really comes into play for a lot of screening, identifying of victims, trying to prevent things before it gets worse. Tertiary is our long-term response, so looking at the aftermath, right? So from a criminal justice perspective, there are things that they put in place. So victim advocates, people who will go to court with you, try and provide that emotional response, but making sure that we have funding for our different crisis centers, shelters, that this is not something that you just snap out of one day, right? That it's got to change your whole system. You're going to need housing. You're probably going to need employment assistance. You're probably going to need long-term health care, long-term mental health care. So figuring out the ways to reduce the burden of that trauma and really help make that switch from victim to survivor and help them figure out how do you integrate these experiences into your life narrative. So by focusing on the social determinants and social needs, we're trying to move beyond midstream, right? The ideal would be to create an environment that isn't so conducive to all of our different forms of violence. These match our rates of suicide and gun violence and all of these different things. But we're not where we need to be yet with that. That's the hardest thing to change. We are in a lot of cultural shifts right now. Virginia is a microcosm of that. But thinking about, what does that mean at the community level? What can we do to make it harder for sex trafficking to occur? Because it's happening because there's a market for it, right? So if we're looking at public health and how we're approaching this, our priority areas right now are looking at more precise prevalence and incidence data. So it's really, really challenging to actually get accurate numbers on this, right? Because again, some of the trafficking victims might still be living at home, or they might not, many are probably not going to identify as a trafficking victim, right? And there's a whole host of reasons for that. That's a lot of psychological and emotional labor to put that on yourself, right? So trying to really understand so that we can make a case for where we need resources. Understanding human trafficking across the social ecological levels. So, we're getting better. We know more about individual levels, still interpersonal, of those, what makes somebody vulnerable, but we know less about how to fix the communities that are increasing this vulnerability. Determining more concrete risk and protective factors that also address resilience and survival. So again, looking at and working with survivors and understanding what is it that helps you recover and thrive, and from your perspective, what can we do differently to help prevent? So really focusing on an asset-based perspective. Systematic, validated, interdisciplinary approach to improving screening. So we've got a lot of people trying to do a lot of great things, but we're not quite where we need to be yet. So there's no one agreed upon screening tool for human trafficking. And it's going to look different in different settings, right? So how somebody might screen in an emergency department is going to be very different than how a resident advisor might screen in a dorm. But what we're coming to understand is we need both of those people trained in how to screen. So that's where the research is at for us, and what we'll talk about in a minute. And then developing age and culturally appropriate, theoretically based prevention strategies. So how do you talk to your teenager about all forms of sexual exploitation on social media might be very different than how do you talk to someone who doesn't have English as a first language, who may be an undocumented immigrant, who may have different sets of challenges. So one size does not fit all, because these profiles look a little bit different. So kind of going into this area where we talked about screening, we want to spend a little bit more time because I think the majority of the audience is healthcare professionals. So what does this role look like? And do you want to talk a little bit about why we're going to come into contact with healthcare?
So just read what's on this screen, okay? So depression, anxiety, PTSD, substance use, suicidality, asthma, heart disease, sex health issues, AIDS, HIV, STDs. So everyone, if you've ever come into contact with a patient with any one of these ailments, comorbidities, whatever, please raise your hand. So if you look around, that's almost every single person in this room. These are all very, very common manifestations of survivors of human trafficking. These people who are coming into contact with healthcare providers are not coming in as a means to get away from their trafficker. These people are coming in because they have chronic pain, they have anxiety, they need treatment for an STI. So these are the common things that we are looking out for that are affecting the lives of so many that are so important to be aware of, and that's kind of what we're going to go into are kind of red flags, screening tools like Dr. Carlisle said. There's no standard or universal screening tool, but I think that this is a good starting point. And again, the reason why we are going to go into this is because we're all missing the target here. About 90% of human trafficking survivors report seeing a healthcare provider while being exploited. That's 90%. 9 out of 10 people who are being trafficked are seeing healthcare providers like us every single day. 97% report never receiving information on resources on human trafficking while visiting a healthcare provider, and most healthcare providers just report that they have never received training on human trafficking, hence this symposium. So, going over the screening for human trafficking. So, right now there are innumerable victims of sex trafficking who need to be identified and connected to these resources. And screening, like Dr. Carlisle mentioned, is a part of the secondary prevention of the public health kind of model, and the strategy has been to reduce the long-term health consequences that we mentioned earlier associated with trafficking. So what are kind of the red flags? So this is taken from, I think, the American Hospital Association website. So people who are coming in with kind of an inconsistent clinical history. Their presentation is not really matching up with the history that they're telling you. Sometimes it can seem scripted, it can seem memorized, just like someone has told them to say a certain thing and avoid certain phrases. Someone who is with the patient, male or female, it doesn't have to be kind of that stereotypical older creepy man who is there. It can be a woman who is there kind of controlling and kind of you sense that avoidance of eye contact or kind of looking to the other person in the room before speaking. A patient appears fearful, anxious, submissive, hypervigilant, or paranoid. Patients concerned about being arrested, or going into jail. going into like, oh, but I don't really want to go into that because I don't want to deal with the police. Patient's concern for his or her family's safety. And again, these are not things that a patient is going to offer you. You have to ask about these things, and we'll go into kind of questions to ask. Evidence that there has been lacking for prior existing care has been lacking for prior existing health conditions. So chronic issues that are very easily treatable that are not being treated. Tattoos or insignias indicative of ownership. So historically, there have been tattoos like king or crowns, things of that nature, but that's always changing. And I actually have recently heard that the traffickers have been informed that healthcare providers are very aware of this kind of tattooing pattern, and they're doing it less and less. So all of these red flags are always changing, so that's why it's important to always keep updated with them. And then the last few, which we mentioned, occupational type injuries or physical ailments, a link to their work, and then sexually transmitted infections. And then red flags for possible signs of child trafficking. So we'll kind of stick to the sex trafficking side of it, as that's what we've been kind of focused on. So children who are carrying around excess amounts of cash, people who have hotel keys in their wallets, multiples, chronic runaways, or homeless youth. This is also a huge risk factor for children entering or being trafficked. Lying about their age, having a false ID, again, the inconsistencies in their story, has engaged in prostitution or commercial sex acts, because remember, prostitution and commercial sex acts in a minor is automatically human trafficking. Any mention of a pimp or boyfriend, or kind of referring to their boyfriend, whoever's in the room, as daddy, things of like that slang nature are things to watch out for. And then again, the framework for human trafficking protocol in healthcare settings, though one is not official or kind of implemented everywhere, this is from the National Human Trafficking Resource Center, and I think that this is a good kind of starting point. So the red flags that we've mentioned, I'll skip over those, but I just want to go over kind of the questions or like the discussion points to ask. And again, language is also very important. Know your audience, know who you're talking to. If you're, talking to someone by saying, have you been forced to engage in sexual acts for money or favors? Someone is not going to be very inclined to tell you yes. If that's the case, because they're just going to look at you as this very far removed person who doesn't get it, who is not kind of like, they're just going to be like, what are you going to do for me? So these are just kind of suggestion questions, but again, using kind of language that relates to the patient is very important. Is someone holding your passport identification documents? People are not in charge of their lives here. Has anyone threatened to hurt you or your family if you leave the situation? Has anyone physically or sexually abused you? Do you have debt to someone that you cannot pay off? Does anyone take all or part of the money that you earn? So these people are not in charge of their finances. They're not in charge of any of their identification. They're not in charge of any aspect of their lives. Yes?
The first question there, what are some more appropriate ways to say it?
Do you have, when you
Which
have,
one?
the first one, so the question is,
How do you word it?
Have you been forced to engage in sex acts for money or favors?
so very simply, do you have sex when you want to? Are you having sex that's unwanted? When you do, if you are having sex that's unwanted, is someone giving you money for it? Is someone giving you food for it? Things like that.
Thanks.
Mm-hmm. A lot of like the domestic violence screening will kind of start with that positive spin. Do you feel like you're in a healthy relationship? Do you feel respected in your relationship? And so kind of snowballing from there. Do you feel like you get to have equal say in deciding when you engage in sex? Do you?
But if you talk about how they don't understand what a healthy relationship
Right.
is, if you ask them if they're being respected, they only know that they are, even if it's not.
Yeah, and everybody has a different definition of respect too. Like I said, we're still trying to figure out the best way. A lot of times the initial question is, do you feel safe at home? And you'll get everything from, well, no, there's this rug I trip over all the time, right? To, oh, you know, and most of the time people who are genuinely afraid aren't going to say something. So it's more kind of trusting your instincts as a human and as a healthcare provider and seeing what are their nonverbals saying when you're asking these questions, which is the problem, because if you think about, I've been screened not nearly as often as I should be, because I should be screened all the time, but most providers, when they ask, do you feel safe at home, haven't looked up from their clipboard or their computer.
Or their significant other is sitting right next to them and they're like, he doesn't beat you, right? Or some, you know, they don't take it very seriously.
Mm-hmm. And so there's all sorts of those things, but anything you can get at that helps them talk about their relationships, or like when I think about a teen, if I was going to ask them about exploitation, I'm going to be more concerned about social media. So I'm not going to say, you don't share naked pictures, do you? Because that's, again, stigmatizing the behavior that we know is happening. So, have you ever felt pressured to, you know, share images or do more than you wanted to on social media about anybody? Because it might not be their boyfriend. And what's challenging about this is, as humans, we've all kind of built this protective layer that helps us get through the day of what these victims look like and what these predators look like. And so you forget to screen people who look like me. And you forget to screen my kids. And you forget to screen, you know, you just, the thought that it's parents that are trafficking their own children is really hard to digest. But we gotta kind of get over our own protective mechanisms to be open to that possibility. And it's really hard to do. A lot of my research has been with providers of how, you know, what have been their challenges for domestic violence screening. And a lot of it is, as healthcare providers, you want to fix things. That's what you're trained to do, and that's what you're really, really good at. You want to fix the problem. But in these areas, you're not going to fix the problem, especially not in one visit, right? We know, at least in the domestic violence world, it probably takes at least 7 times before a person leaves for good. Understanding that it's not your role to fix the problem. What you can do is identify the problem. That's what we need you to do, and connect to resources. That there's a team of social workers, of criminal justice out in the community, that if you can connect people to those resources, then the people who are trained to do that and fix and can do there for the long term take over. And so the most common reason that we saw in our focus groups for people not screening is because they don't know what to do when they get the yes. And so, again, trying to understand, it's heartbreaking and it's draining, and sometimes you're just going to get the yes and you're not going to know what happens after that once you hand them over. But getting that yes and being able to connect people is the best chance that they have.
Were there questions still?
Right, just, I think setting the tone too by saying, many women find that if they have an opportunity to share this information, we want you to know you're not alone, and that we have resources for you, but that we ask these questions of all women.
Yep.
So that they don't feel they're being isolated or that you look like someone who.
Absolutely. Or when you give information that, you know, like just, because, you know, sometimes we'll give the statistics, like if it's not happening to you, most people know someone that this is happening to. But again, kind of using caution in how you display that information and how you give information to people. If you suspect that someone is being abused, you probably don't want to send them home with a brochure, right? So we have shoe cards, other forms. You have to make sure that the information you're giving them is safe for them to have on them. One of the pictures that's been going viral on social media the last week is from a doctor's office where the sign in the restroom says, you know, please write your name on the specimen jar in black ink. If you would like to speak to a healthcare provider in private, please write it in red ink. Right? So, because one of the challenges and one of the soft skills is how do you separate that partner from the patient that you think might be abused, especially if they're a minor.
Why would you just routinely see your patient by themselves? So it's not that they don't have to do something extraordinary to get along with the provider.
Well, it depends on the context and what the health issue is. So the other side of folks in my department look at a lot of patient-provider communication, and having that support person is beneficial in a whole lot of reasons and a whole lot of situations. The only time where it's usually bad is in an abuse situation, and those are going to be the people who are going to fight you tooth and nail to stay with the person. It might be that they're the only person that can translate for them, or I mean, if they're in that abuser role, they're going to be very controlling and the one speaking, and it will take a very assertive person to get them to stay in the waiting room and things like that. It's not always they're not always the most respectful of the boundaries that you're trying to set as well. It's tough, and so when I've talked with my friends who were forensic nurses, a lot of the tactics they do is like they've had to actually go into the restrooms with the patient. So they couldn't separate them in the exam room without it actually being a physical altercation. And so in saying they need the specimen, then they will actually go into the restroom with them, even though that's obviously not necessary. And that's where they have the conversation and screen. So you've got to kind of get creative.
Sure. Just a comment on asking about these questions. I think any of these types of questions, obviously there's all the screening tool, but you need to set up the framework to ask those very direct questions, just as we do with like suicide screening or abuse screening, that we ask those kind of surface level questions and just kind of set the tone. I also think it's important to recognize that a lot of these individuals do not self-identify as being forced to do these things. So I think another way of asking is saying, have you ever needed to trade sex for money or for shelter or for food? And especially the youth, talking about it in terms of trading is a little bit more effective of getting at that, especially because of all the stigma about teenagers making their own autonomous choices and that sort of thing. So just the language, I think, in the setup is really important.
Just kind of piggybacking off of that, and this might be more in the criminal justice setting than in a healthcare field, but the question of does anyone take part or all of the money that you earn is really big, at least in my experience, from differentiating between someone who might be engaging in survival sex or prostitution compared to trafficking. Just anecdotally from stuff that I've seen with people, that's a big one that you can typically figure out, oh, this is actually a trafficking incident instead of
Yeah.
I think sometimes it's hard because for healthcare people, because most of the time the control person of the human trafficker has kind of brainwashed them to believe that anybody outside is going to take away things or hurt them or whatever. So it's very difficult to build that trust in a one visit time. I mean, you can come in and have some red flags, but it's very hard to break down those barriers within a 15-minute time frame because they've been drilled into their heads for so long, over such a long period of time, that it's very, very difficult to have that breakthrough moment with somebody coming in with infection or something like that. So I don't know how you combat that other than possibly trying to get them to come back. But like for me, I'm a CASA worker, and I know when we deal with teenagers, it takes months to establish trust. It takes months to establish any type of rapport where they feel like they can open up to you. So, I mean, that's got to be a huge, barrier for people that are dealing with, people that are only coming in 1 or 2 times in the course of the year.
Yeah, it's a challenge, and that is a barrier that they talk about a lot, that it's going to, they worry that if you screen too soon, that it's going to prevent you from establishing that relationship. But you're right, you don't always know if you're going to get another point of contact. And so it's finding what is that balance, and can you, in those cases, maybe talk about there's, these resources out there, just so you know, if you or your friends, we're seeing this a lot among teens, and just telling them a little bit about, there are places like you could go to Side by Side, or you could go to Safe Harbor, or those names where if they need those, that might stick a little bit.
And I totally also agree with establishing good follow-up is very key, whether or not that follow-up is medically indicated. You know, we talked about the ICD-10 codes that are new for human trafficking, so billing would never be an issue for these follow-up visits. So I'm really glad that you did bring that up, because it is very, very key to establish that follow-up, because like you said, it's not going to be kind of a 15-minute conversation.
So, trying to come full circle, looking at the benefits of a public health framework, so broadening our understanding, right, and our ability to address human trafficking while trying to get some resources that complement the human rights and the criminal justice approaches. So as you know, Alina started out talking about, these approaches are not in contention, and more they are working very synergistically to kind of make sure that there is that team when victims are identified, so that they can make that transition to survivor and have those resources. But without that public health framework and understanding, then we're not going to have those community resources that we need, right, that can address those long-term health consequences. Public health framework helps us get more people involved, right? So thinking about ways that you can work in prevention if you're not in law enforcement, right? That this is actually everybody's problem, everybody's issue. When we talked about, when Alina was going through the child trafficking red flags, these are things that you can look for if you have children, right, in their peer group. You can see changes. If you're faculty like myself, knowing the red flags for sexual violence, you know, has helped me identify students who've experienced sexual assault without them disclosing, right? Same thing, kind of training people to recognize what they are. You can have more people invested in the problem. So reframing from this, again, reactive to preventing, focusing on systemic preventative solutions rather than individual downstream criminal justice or even individual public health approaches. And so not only, again, would we be trying to prevent human trafficking, but if we really did this effectively, if we could get at those upstream approaches, we would be disrupting the cycle of abuse in a lot of different issues, right? The precursors to human trafficking are the precursors to all sorts of interpersonal violence.
And I guess kind of our emphasis to leave you with, again, is a public health lens recognizes that we can't just arrest our way out of this issue, and we can't eradicate it through victim services alone. So what we want to just leave you with is kind of this model that we have a synergistic approach between healthcare and public health, criminal justice, and then all of the different community organizations, which are all very, very key to work together to kind of utilize everyone's strong suits to really kind of eradicate human trafficking, not to belittle it, but.
I just have one thing. Has anybody seen this? It just came out, 2020 guidelines for healthcare providers. Take a picture of this, read it. It answers a lot of questions, actually, that you brought up. It even has like scripted like quotes on what you can say. Well, you really have to start on the periphery. You can't just dive into the questions. And you have to build trust and rapport before you even start to screen. So, you know, establishing that trust and rapport, even looking at them when you're talking, that is going to have them come back. Not being judgmental, that's going to make them come back. You know, like you're listening, that's what's going to make them come back. So you start with the basics, right? So please take a picture of this, read this. It's phenomenal, phenomenal. We're going to meet in the other room for lunch, and Christina Barr from Geisinger School of Medicine will give us a talk on her sex trafficking curriculum. So thank you so much, Alina and Kelly.
You're amazing.
I've been teaching for me.
I'm gonna run to the restroom. Okay, I'll see you in there.
Okay, cool. Thanks.
Do I stop the share now because we're moving?
Don't know.
Right? Or should I just let Todd do this?
I think you can. He said don't mess with the one and the other.